Hello, my name is Ezekiel Oboro. I'm an orthopedic surgeon at Nairobi Spine and Orthopedic Center, and today I'll be talking about one of the most common conditions that I see in the clinic. This is known as plantar fasciitis. So plantar fasciitis is a condition that usually affects a certain structure in the foot. It's known as the plantar fascia. The plantar fascia extends all the way from here and it extends towards the toes. Obviously we can't see a good outline of it, but yeah, that is where it is situated. Now, patients with plantar fasciitis will complain of pain, and usually this pain, not all the time, but has got a characteristic or a classical history. The patient will say that they have a lot of pain when they wake up, especially early in the morning, or when they're taking a bathroom break, or they're going to the bathroom in the middle of the night. So when the first steps are usually very painful, and then things get a bit better as they start walking. Now, the other thing is also they may complain when they are in an office, like when they come to my office to see me. They are okay before while they're sitting, but when they stand and when they walk a little, there is a lot of pain. So usually when we examine, we get pain around this region here, which is very near to where the plantar fascia originates. And the pain is mainly around here, though it may vary. Sometimes it may just generally be around there. And these patients will complain of a lot of pain at that region. Sometimes they will have tenderness when you examine. Now, what are some of the things that we can do when a patient has plantar fasciitis? I see a lot of these patients in my clinic, and one of the things that I tell these patients is what they must do is they must stretch. Okay, so actually I usually take my phone and I just Google plantar fasciitis. In fact, Google remembers all the time. I Google plantar fasciitis and I just see plantar fasciitis stretches, and I tell the patient go to images and do all the stretches that you can find on images. I tell them go to YouTube, go to Facebook, go to Pinterest, and all those stretches is what is going to help. Sometimes I demonstrate to the patient. So for example, I will tell it here to put the foot over there like that. I'll tell it, can you take this hand and pull up there, and then take this other hand and massage there. So I tell them to massage there all the way there, and then you can see the outline of the plantar fascia over there. So you can see all that. Okay, so that's a plantar fascia. So they're massaging all the way over there. Okay, so that's what I tell them to do, and I tell them to do that. So really the treatment is stretching. I tell them to stretch like crazy, stretch all the time, and that should be able to work. Sometimes also I tell them you can get an insole, and with the insole you can put a heel cushion, and that will cushion when the patient is walking. But there are other devices that you could also use. One is a night splint, and usually the patient will take a night splint. They'll wear it in the night. The good thing with the night splint is that it will keep the foot like that. And so what will happen is that when the patient wakes up, at least the plantar fascia is stretched and they don't feel any pain. Other things that may help is a strapping, and the patient may have a strapping that may help. If you put a strapping over there, kind of like stretches the foot strap, that will stretch the plantar fascia a little bit, and that will also help. So the other thing that you tell the patient that they probably need to lose a little bit of weight, that will help. But the take-home message is stretching. What about an injection? Because many times patients come to me and they ask me, what about an injection? Because some of them have received many injections, some have not received injections, but they're really interested. And usually the injection is given here. Usually it's a steroid injection. I don't usually give steroid injections as much unless the patient is really miserable. I usually start with stretching, shoe wear, modification of an orthotic in the shoe. If that does not respond, then I give an injection. All right, injections are not without consequences, so I avoid it, and I would only give a maximum of 2 injections. this stretching really solves the problem. What about surgery? Surgery is rarely indicated in this condition. Sometimes we may do an operation where we release the plantar fascia or half of it, but really I try and avoid this as much as possible. So when you see plantar fasciitis, just know it's stretching. What about a calcaneal spar? Because patient will come to me and they'll show me x-ray and say, oh, I have a calcaneal spar, Dr. What I usually tell them is really it's plantar fasciitis, not the calcaneal spar. Because some patients have a calcaneal spar, but they don't have pain. Some don't have a spar, but they have pain. So we are essentially treating plantar fasciitis. Remember, when you hear plantar fasciitis, it is stretching. Thank you very much.